that's my baby, Zinhle Ivana Makwaza, is 10 months old. She was born 36 weeks because she had a cord around her neck, so she was born via C-section. When she was born, she was perfect, nothing wrong with her. The doctors didn't notice anything. So when she was 6 months, we thought she was coming down with the flu. We had taken her for vaccination. So we thought maybe it was the vaccination that's making her sick. But she got worse and we took her to the hospital. At the hospital, they said they can see that her heart is enlarged. So they decided to do an echo. So after doing the echo, they saw that she had 2 holes on her heart and she has trisomy 21. That was at 6 months. And also she had pneumonia. So we stayed in hospital for 2 weeks and she was discharged. They told us that we can come back for a cath after 1 month when a lung pressure is reduced. So after 1 month, we thought maybe she's going to get the operation. We went back to the hospital. They told us, no, the baby is too small. She must increase weight. We cannot do the cath. So they sent us back home. So we chose this hospital because my aunt last year, she came here for heart bypass. And so they said, it's world-class hospital, you should go there. The people there, they are wonderful. The doctors there, they are wonderful. So we trusted her. That's why we chose Manipal. So we came here. When we came here, the doctors in South Africa, they had said, when your baby's lung pressure is high, there's no doctor who's going to want to operate on your baby. So just pray that the doctor's lung pressure is not high, that the baby's lung pressure is not high. So we're very worried about the lung pressure. That's, if it's high, no one is going to operate on her. So we came here with our fingers crossed that the lung pressure is low. But unfortunately, when we came here, the lung pressure was very, very high. So we got very worried. But I spoke to Dr. Devanada, and he said he could not just leave the baby like that. It's inhumane. He would try everything possible to operate on the baby. They started on treatment to reduce the lung pressure for 3 days. Then after that, he decided to operate. So for those 7 hours, she was in theater. I was a wreck. I was a mess. So they called me after 7 hours. I couldn't even think straight. I just asked them, is the baby okay? And said, yeah, come and see your baby. Then I went, I saw her. She was on ventilator for 4 days. Then after that, they removed the ventilator and lung pressure started to reduce. She was on nitric oxide to reduce the lung pressure. So now they are discharging her. She's perfect. She loves it here. She loves the nurses in ITU. Sometimes I think she loves them more than me. She cries for them. They are so perfect. They love her like it's their own baby. They don't see that this baby is from Zimbabwe or this baby is from Africa. They just treat her as a baby. And she really loves her. Everyone in ITU is perfect. The pediatrician is perfect. She explains everything that you want to know. Everything is perfect. And our travel here, it was flawless. Ramesh and the hospital, they organized everything. From our plane tickets to my accommodation, everything. Even if I want a taxi, I just tell them that I want a taxi to go somewhere. They organize. Food, they organize everything. So me, I just sit and say, guys, I want this. Then they organize everything for me. So I'm lost for words. I can't thank these people enough. Because if I was somewhere else, no one was going to operate on the baby because of her lung pressures. So I just want to thank Dr. Devanada and his team. May God bless him and give him many more years so that he can save more babies like my baby. Thank you.